Yes, we are conducting a series of projects at the Simpson Center on ways of improving the end-of-life experience for patients, doctors, and families. So this comprises about a couple of dozen projects along the patient's journey, which is from the time they're diagnosed as having a terminal illness until after death. And for one of the examples is we developed the Crystal tool, which is a checklist based on objective clinical parameters to determine the risk of death to the person during a hospital admission and in the subsequent 3 months. Another project is, for example, a systematic review looking at the extent of non-beneficial treatments applied or administered to elderly people who are seeking emergency assistance in hospitals at the time of, in the last few months of life. Another project is the impact of advanced care documentation on the clinicians' willingness to engage in the end-of-life conversation with people who haven't been told they're dying. Another project is we have consulted consumers, that is, patients who are terminally ill, their families, or relatives of people who have died bad deaths in hospital, to find out about their priorities at the end of life, their preferences, and how satisfied they are with the care they received. So these are sort of a range of examples. We have many other projects we have involved clinical decision makers, policy makers, consumers, and many other researchers, nurses, and doctors in telling us about where the gaps are and how things can be improved. With some of the findings of our research, for example, we did a systematic review on decision aids, and we showed that, first of all, there are very few instruments out there to assist patients and families in making decisions at the end of life on what sort of treatment to have. And some of the instruments have deficiencies, such as they lack numeric prognostic information about the harms and benefits of each of the treatment options. So that is really not very helpful for patients because they will not be making a genuine decision on something as important as whether to have a treatment or not. And they also lack step-to-step information about how to make the decision which route to take. And more importantly, they lack the information the patient values, what matters to them, quality or quantity of life. And that is a big gap that needs to be filled because genuine decision-making cannot happen until those gaps are filled. And the other results that are important to us was the validation of the Crystal tool in 14 hospitals across 5 countries, which showed that the accuracy of the tool is over 80%, which we're very satisfied with because we're not dictating treatment as a result of this accuracy. We're enhancing the prognostic certainty for doctors so that they can initiate the end-of-life conversation.